Dr. Hasse and I talked about many of the benefits of BergaMet, and some of them are noticeable. For example, improvement of vitality, sexual energy, maybe some weight loss. In women, improved mood, maybe fitness, and certainly loss of menopausal disturbing symptoms are something you're going to notice and you're going to feel a benefit. But I firmly believe that the most important benefits of BergaMet are hidden. And this is important because you're not going to notice an improvement in dangerous cholesterol particles. And you might get discouraged. And what we're finding out is that BergaMet has its best benefits when it's used for years, maybe a lifetime, not 2 or 3 months and then switching to something else. I want to address the hidden benefits because even your physician will not generally detect the most important benefits of BergaMet. Let me give you an example. Most physicians do what's called traditional cholesterol testing, and you know it by the total cholesterol, LDL cholesterol, HDL cholesterol, the good cholesterol, and triglycerides. And we obviously hope that cholesterol will go down, and it does go down over time with BergaMet. But much more strikingly, and hidden from view from 90% or more physicians, is that the actual dangerous particles, the much more important aspects of the lipids, like what we call LDL particle number and ApoB, very dramatically improve with BergaMet. You're not going to see that kind of change, for example, with berberine, which sometimes people say, well, I'm on berberine, which is a nice product, but not like BergaMet. So if your physician is not doing what's called expanded lipoprotein testing, then that particular benefit, which is the most important aspect of cholesterol control, the number of particles that are attacking your vessels, if that's not detected, you may look at your cholesterol levels and say, you know, it hasn't changed much, I'm going to get off the BergaMet. What we've learned, and some of this came from a new study called the Scripps Lipid Intervention Trial, or the Scripps Lipid Trial conducted by Dr. Douglas Triffin, is that the particle number goes down very rapidly, which is very good news, but the cholesterol concentration that your doctor is going to measure, if you already start out with a pretty average cholesterol, it may not change much. And in fact, in a few people, for about a month or so, the cholesterol actually go up. And you're going to say, this is not working. It's going up because, remember, the BergaMet addresses the fat in your liver. About 30% of us have too much fat in our liver. So what happens is the very first thing that BergaMet does is take that fat from the liver and pour it into the bloodstream, thus increasing your cholesterol level, which to you would look disturbing, but it's good news. So that's called lipolysis of fat in the liver. What about vessel health? Very rapidly, BergaMet is improving the health of your vessels. That's the key to preventing heart disease and living a long life. And we measure that by very technical means in a laboratory, what's called endothelial function and arterial stiffness. So the lining of all your vessels are improving, and the stiffness of your arteries are improving. But unless your physician has access to tests, and I know very few in the world who have that kind of access in their office, you're not going to notice the benefit, and your doctor's not going to notice the benefit. What about liver function? Well, getting rid of fat in your liver can be detected if you do ultrasounds, but who among us are doing regular ultrasounds of our abdomen to detect that? So I want to emphasize a couple of things. Your cholesterol level may not budge much, especially if you start out with a pretty good cholesterol. But if you measure particle number, it'll improve rapidly. Second is that your vessel function universally is improved. Your arteries become nice and compliant, and so the stiffness is not there. Your arteries become younger. And remember, you're only as old as your arteries, okay? And so you want to have arteries that are young and healthy, BergaMet's going to help you to achieve that. So I just want to emphasize again, we're noticing that benefits improve over time. So renew this or make purchases so that you can get the benefits of months or many months or years of this. And second, it's gratifying that certain symptoms are improving. But just remember that the real important benefits over a lifetime are often hidden from view from both you and your physician.